Hello, everyone. I see some people are still joining, but I'm delighted to introduce our keynote speaker today. Um, First of all, my name is Russ Bennett. I'm a consultant in health literacy, strategy, and marketing. And it really is my pleasure to tell you a bit about our outstanding keynote speaker today. She is Amanda Aguirre, MARD. Former Senator, Arizona Senator Amanda Aguirre is president and CEO of the Regional Center for Border Health, Inc. since 1991, and its subsidiary San Luis Walk-in Clinic, a primary care rural health medical center. Ms. Aguirre has been involved for more than 35 years in healthcare and business administration and has lived in Yuma, Arizona for 30 years. She has a lifelong commitment to education and a passion for improving communication between providers and patients to improve outcomes, and hence her interest in health literacy. In 2007, she established a licensed post-secondary vocational training center devoted to allied health training, which has generated job opportunities for well over 2,000 students. Ms. Aguirre built these startup businesses into multi-million-dollar corporations, today providing employment for 385 Arizonans, and has done that in a slowly recovering economy. The Regional Center for Border Health has become a unique organization. I've had the opportunity to visit it in Yuma, in San Luis Rio Colorado, in San Luis City, sorry, and it now includes 6 clinics serving Mojave, La Paz, and Yuma counties, a new medical mall, an outpatient surgery center, and other medical facilities, in addition to the College for Health Careers. Her commitment to education was sparked by her parents, who were both school teachers. Her democratic values come from them, who taught her to work hard and to serve her community before everything else. In 2003, Ms. Aguirre became the first female and first Hispanic to represent District 24, new Legislative District 4, in the Arizona House of Representatives. And following that, she served in the Arizona State Senate from 2006 through 2010. During her time in office, Senator Aguirre had great success in passing key bipartisan legislation, including SB 1263, Autism Spectrum Disorder Stevens Law, which requires private medical insurance companies to provide autism intervention service coverage under their insurance plan benefits. HB 2526, the creation of a breast cancer awareness special license plate with proceeds benefiting cancer screening for uninsured women. She secured over $1 million to fund the state diabetes prevention and awareness campaign, and HB 2599, establishing liability protection guidelines for volunteer citizens performing emergency medical assistance during a state of emergency, and many other legislations that have had a positive impact in the state of Arizona. She holds a bachelor's degree in chemistry from the University of Sonora in Hermosillo, Mexico, and a master's degree from the California State University in Los Angeles, with emphasis in nutrition and dietetics. She was also a presidential appointee to the U.S.-Mexico Border Health Commission when that commission was established by the U.S. Senate. As a lifelong learner, Ms. Aguirre has also completed executive leadership certificates at Cornell University and at John F. Kennedy School of Government at Harvard University. Today, she will speak to us about her organization's response to the pandemic and how they are supporting the community's recovery and resilience. So let's go to Ms. Aguirre's talk. And during the talk, if you would be kind enough to put any questions you have in the Q&A box, I will read those questions to her as once we end the recorded part of the session. Please, Mario, go ahead.
Good morning. Thank you, Russ, for that introduction, and welcome everybody to the annual Health Literacy Conference in Arizona 2021. I'm Amanda Aguirre, and President and CEO of Regional Center for Border Health, and it's my pleasure to be here this morning. Our center covers the western part of the state through Mojave, La Paz, and Yuma County. We have different locations, as you can see. And we're committed to improving the quality of life of residents along the U.S.-Mexico border by increasing accessibility to training and affordable healthcare. This is our newest facility located in San Luis, Arizona. Most people know us by Western Arizona Area Health Education Center. Those have been around in Arizona for a long time. It was established in 1987. We have a great partnership with University of Arizona through the border regions to deliver the mission and the goals and objectives of the AHEP program in the western part of the state, improving the quality, again, and education of those communities in rural areas. Interprofessional clinical rotations is one of our major goals, and to bring those that are dedicated to provide medical care and invite them to come to the rural communities. So you see a lot of them right now in the picture in collaboration with the medical school at U of A, the Arizona Health Science Center. And we're growing our own. This is one of the annual programs that we're glad to be part of it through the AHEP programs and Regional Center for Border Health by participating in the MESTAP program every year. This is for students from all over the state, and certainly we have a good cadre of students that can participate from Yuma and Mojave County and La Paz County, and we just had an anniversary of their 25 years of being sponsored by the U of A. In 2003, Regional Center for Border Health established its rural health clinic, the San Luis Walk-in Clinic, a patient-centered medical home for better care, for better health of patients, and low cost through a comprehensive, continuous delivery of health care. We have several locations throughout the western part of the state. And here's some of our pictures from the different locations, and our newest clinic, Pediatric Center in San Luis. But patient-centered medical home, as is defined as primary care that is accessible, continuous, comprehensive, family-centered, coordinated, and compassionate, and culturally effective. Those are very key aspects of how we deliver the care in our rural health clinics. This is a little busy slide, but I wanted to share it with you this morning because we have a fully integrated behavioral health with our primary care medical home services. So the patient, wherever they come, whatever the entry is, whether it's primary care or is the behavioral health, will come into a continuous of care provided by both teams, fully integrated. And of course, we're reaching the most distressed communities along the rural communities in Yuma, La Paz, and Mojave counties by increasing access to affordable care. We have several mobile units. There are licensed medical units, and we provide all primary care services. They have become very handy during COVID-19, as you'll see in the slides coming up. But other initiatives that we have put in place to increase access to care, to have a better reach for the patients that we serve in, is the Yuma County Community Paramedic Program. Main project goals was to reduce utilization of the emergency medical assistance for non-emergency situations, improve access to primary care and behavioral health services, as well as to reduce the emergency department utilizations and to reduce hospital readmissions, reduce healthcare costs as well. And in partnership with our local fire department in Somerton, as well with the city of San Luis, we've been able to put together this an incredible program that is an interprofessional approach to community-based paramedic project addressing social determinants as well. So many aspects of this program that includes the interprofessional integration is the family care coordinator, formerly known as patient navigators or promotora de salud, And they are key in providing the support needed by the program participants, such as, but not limited to, educating patients, their families on the importance of behavioral health lifestyle changes, medication compliance, and of course, assisting the patients to navigate the healthcare and social systems through referrals and enrollment in the different social programs, such as SNAP, Access, the Marketplace, Food Bank, the WEEK program, and again, behavioral health services. And most importantly, provide cultural sensitive health education and prevention education. And of course, this is where it comes with our health literacy, most importantly, to understand, for the patient to understand basic information, understand the medical information that is being provided by them. In the pictures, you'll see some of our promotora de salud or family care coordinator, and along with some of the Somerton paramedic staff members that visiting several of our patients, where they go to the home and visit the patient to count the medications, making sure they're following the instructions and they don't have any other questions. But also, they do an assessment in the home for any fall prevention for the elders and the seniors. So it's a very integrated way to take care of the folks that are in rural communities, and bring in the support that they need to live a healthy life and safety life. So addressing the healthcare disparity has been one of our biggest challenges, but nonetheless, we have put in place several components that you can see in this slide, where it's surrounded by patient navigator concept. Again, we use the concept of patient navigator or family care coordinator, which is recently what we call our promotores de salud, as they have been integrated and totally integrated in our medical centers, in our rural health clinics. So by having an evidence-based continuity of care with our providers, doing the case management, understanding medical records, patient follow-up, the health education that is so important for disease prevention and control, setting up group and one-to-one education sessions, and most of all, making sure that the appointments, that the patients are not breaking the appointments or making it accessible either by telehealth or by telephonically or visiting the home, and having a better outcomes of health. So, but we still have challenges. When I integrated the system to become the promotoras or patient navigators to become integrated in our clinics, there was some resistance from the medical staff and personnel. They really didn't understand of the role of this community outreach worker in the clinic, and they wonder what is it that they're doing in our clinic when they don't have a medical background. And the purpose was not to have a medical background, because what the promotora or the community outreach worker brings is that cultural sensitivity, again, the health literacy, that patient will understand better the instructions of the doctors, the nurses, and the medical staff to follow the instructions to better take care of themselves. So that was one of the challenges. Also, the EMR system. For me, as we have moved from different EMR systems, the ability to be able to monitor the outcomes, health outcomes, and monitor the compliance for all the protocols of care, whether it's diabetes or hypertension, including mental health, which is very challenging, but nonetheless, we can have milestones as to what that person with substance abuse or mental health issues has, that we can assess again with our mental health professionals to see whether we are making a difference in the life of those individuals, or whether we need to bring a stronger support or referrals to a higher specialist in the area of psychiatrists. And of course, one of the things that I like the most is the emotional support that a community outreach workers brings to the client and to the family. That is unmeasurable. So the only thing I can say is that it can come along with measuring with the outcomes and compliance of the patient, but that is priceless. So then we had all these great things going on, and then the pandemic came along. And so we have to change our way of how do we do business, how do we deliver healthcare to the patients that need it the most. And of course, those patients, they've already been isolated. How do we continue reaching out so they don't feel and they don't go fall through the cracks and not be in compliance and not having the medications that they need and the support that they need that we've been giving them through all this time. The picture that you see is the teams that we have to assemble to respond to this emergency, to start providing the testing, making sure that all my team had the PPE necessary as we always struggle throughout the state, and acquiring the proper PPE to be able to respond to this kind of pandemic that we haven't seen in centuries. But you can see how far my staff had gone. And the temperatures that were 115 degrees in Parker or in Courtside, or here in St. Louis and Somerton and the rural communities. And so one of my staff is in front of a cooler trying to cool off as he's still, having the gloves and the gown, the face mask. And then another one, being in Arizona, you have those big trucks that have to climb to the truck to reach for the family to get tested. My team consisted of over 30, 50 people at one time when we coordinated some of the COVID testing with the state, the Blitz event that we coordinated through on the weekends. Some of the times the biggest event that we coordinated, we tested over 3,000 people in just 3 hours. So that was a marathon. We wanted to break some of the records that the state had, and I actually spoke to the team at ADHS, asking them who has the highest number of patients they have seen through the testing tens. I want to break that record, and we did. Another challenge that we were calling to response and in support of the efforts of the Border Patrol and Homeland Security is the refugee crisis in our border with U.S.-Mexico border. These are the partners that we have been working presently. Of course, the Yuma Border Patrol sector, American Red Cross, FEMA, TGen, a research center out of Flagstaff, Casalitas, the Shelters for Homeless Welcome Center in Phoenix, and the MECA Center in California. This was as a result of our concern and discussing my concerns with our Border Patrol chief that in Yuma, that we didn't want the migrants be just released in our community without having been tested first for COVID-19. And of course, they were all in agreement, and we decided that regional center was going to be the center testing all the migrants that are being released in Yuma County for us to process them. And has been an incredible coordination with the Office of the Commissioner, Troy Miller, which is Mr. Troy Miller is here in the picture with Chief Glams, which is the two biggest partners that we have right now. And here we are in the back of my office in Somerton, in my headquarters. You see in the picture on your left, you will see the Border Patrol bus. They are releasing the migrants, mostly from Cuba and Brazil and other Central American countries. But in the beginning, we're mostly from Cuba and Brazil. And of course, we on the picture on the right, you'll see a charter bus that we contract with to transport the migrants once they have been tested. Those that tested negative, they will get in the bus and then go to Phoenix. We've been working with the Office of the Commissioner to arrange the transportation, but also to make sure that the airport in Phoenix, which we are very appreciative of, have coordinated also when the migrants arrive in Phoenix at the airport, they're being guided to the destinations and their flights that our team here at Regional Center coordinates with individuals to make sure that they know which flights that will be taken to the final destination, which is our goal. All of our goal is to make sure that they get to the family, to the loved ones that they're reaching out, mostly in the East Coast, in Florida, New York, New Jersey, Boston. This is a total number of what we have done in Yuma County and through some of the other testing in Parker as well. But year to date, this is, I believe, the day was up to September the 10th. So we have tested over 120,000 individuals in Yuma County which is about 75% of all the people being tested in Yuma County. The total number in Yuma County reported by the county health department in the state is 161,543. And so for that can show you the intensity of the work that we at Regional Center and our Rural Health Clinic, San Luis Walk-in Clinic has done in trying to isolate and identify COVID-19 in this region. And most of all, this second year of the pandemic, where we have our vaccinations available, we want, and also the variants, the new variants, the Delta variants. So for us, we haven't stopped yet. All our drive-through stations are open on a daily basis, and our urgent care centers are also open all the way through the weekends, providing testing and drive-through testing. And last year, in March 2020, we established our new clinic right in the middle of the pandemic, calling for the emergency. And since then, we have tested 15,000 individuals just in the Parker area alone. And of course, with the migrant refugees year to date, we have tested close to 5,000 individuals. And to the contrary to many groups, so many individuals that might think that the refugees are bringing COVID to the United States, less than 2% of those individuals have tested positive for COVID-19. But with the help of TGen, we've been able to identify in many instances the Brazilian variant, the Delta variant, and just recently the Lambda variant. But it's less than 2%. And those individuals that are testing positive gets housed. They're not allowed to continue their trip to Phoenix, to the airport, or to the shelter, but they are housed here in Yuma in a hotel that we have a contract with until they test negative. And during that time, could be 14 days, could be 10 days. We don't know at what point that individual got infected or exposed to COVID-19. During that time, our team goes and provides food, provides medications, we provide medical consultation, prescriptions, any the family might need while they're staying until that family member or any of the family members recovers from COVID-19. Vaccinations, we're so glad that we have the vaccinations readily available for us, now directly sent to us by the government from ADHS and just recently from HRSA, that we're receiving directly shipments of Johnson & Johnson to be able to protect and provide them to the most mobile populations like migrant farm workers and refugees as well. But yet today, this is since we started our vaccination, we have reached almost 45,000 people. You can see in this slide the different types of vaccines as they were made available to us by the county or the state or the federal government. Johnson & Johnson has been a big request from us to FEMA and to the commission officer from the U.S. Border Protection Office to make sure that we get those Johnson & Johnson, as we were, there was an overstock of a pile stack of Johnson & Johnson in the country, but Arizona was very limited, and we were trying to reach out those clinics. They had some available that they were not using it, and we got some, but nonetheless, HRSA has stepped up now that we're getting ready for the farm worker season coming to Yuma County. As you know, Yuma County being an agricultural base, during the farm season, we get up to 40,000 farm workers, either from Mexico or from the Salina Valley area, and in coordination with the Salina Valley and the farmers, the Shippers and Growers Association, we've been able to coordinate some of those services for the farmers, for the farm workers that are coming into the Yuma area. So after all this pandemic, we wanted to continue making sure that our patients continue accessing our services, making sure that children had immunizations, the women had all the breast cancer screenings, all the preventive services. So here we are in this slide, can tell you that the measurements have been very successful. We still have a long way to go for the young population between the 20 and 44 years of age, accessing preventive services. Those are the hard to get to vaccinate as well, but we are meeting 90% for the seniors, of course, for 45 to 64, preventive services, and that's where our Well Women Health Check program with an uninsured women is also falls into, which we have a pretty good success with children. I want to see it at 90% or above. So we still have some work to do when it comes to compliance with completion of immunization rates, not only in Yuma County, but La Paz County, and recently in Mojave County, where we were invited to be part of that, to be able to provide immunizations for children that haven't been vaccinated in that area, in Lake Havasu, Kingman, and Bullhead City. And we had stepped up to do that as well, to provide vaccination clinics and testing clinics. A very challenging county, but one initiative that also continues to be very successful, even during COVID-19, you can see in this chart that we double and triple the number of the patients that were engaged in our chronic care management. This is a system where my providers are engaged with my staff and my family care coordinators, the medical assistants. It's the whole integrated team, as well as behavioral health, that we make those phone calls to make sure that the patient doesn't need anything, or if they need anything, we are addressing those social determinants that we want to make sure that will improve their health and the continuity of care. So you can see the total number of patients that have been reached through in a year during 2021 fiscal year with my staff making those phone calls. And then the no-show rate, as you can see in this chart, we all in every clinic, we work very hard, try to minimize the no-show rates. So this is where health leadership comes in place. So that the role of the promotora, the role of the community outreach workers is so important in explaining our patients the importance of the no-show, to make sure that they are coming to the appointment, making sure that they're available for a consultation. And you can see in January of 2020, that no-show rate was 36%. And by intensifying our efforts, even during COVID-19, we brought it down to 16%. So it's a significant, success story, if I may say so. But today, we're still going to have to work real hard all the time to make sure the patients come to the clinic, or we reach them through telephonically consultation or via telehealth. Those two tools have become very helpful for the rural health clinics to be able to reach patients during this COVID-19 pandemic. And of course, mental health has been one of the biggest challenges, and that we have seen through all this pandemic, accelerated because of COVID-19, children with anxiety, depression, families still with the opioid crisis, challenges that we face as communities in the border or throughout the state. And so thanks to the partnership with the Institute of Healthcare and Advancement, we've been able to create this incredible booklet that is being provided right now to all the patients in my clinic and in the community as a whole, addressing how to manage the anxiety during COVID-19. And it's been an incredible booklet that has areas where you can keep a diary, and it can bring to the sessions with their behavioral health counselors and share some of the information as well. But it's been very well received. This booklet is in English and Spanish. We had a great request from schools and all over, from high school to elementary school, by the teachers. They really liked this concept or understanding anxiety during COVID-19 as kids are coming back to school or the young adults are going back to college. Has been very helpful. So we're looking forward to continue working with IHA in promoting this type of education, health literacy in our community. And then you have your non-traditional partners. They're working hand in hand against COVID-19. We have, during our Blitz events, of course, we had the assistance of the National Guard, and they were part of our team every day, and we requested to show up in our clinic, and whether we were in Parker, in Welton, in Quartzsite, in San Luis, Somerton, we had the assistance of a wonderful group of young individuals serving in the National Guard. So my respects to them and a big thank you to all of them for helping us. And on the right side, top right, you'll see also the National Guard and the Border Patrol paramedics helping us during a vaccination event that we did at the Border Patrol. So those are incredible partnerships that a big thank you to them for stepping up and helping us and be part of our team as well. And of course, the bottom part is myself with some of my team that providing education, but also the testing and the vaccination in the clinics. And if everything fails, of course, on the left side, you have this incredible helicopter that my son flies. So I can ask him to come and rescue me from at any time. So thank you to my son for his service in the Air Force, and be well and be safe. And of course, thank you all for your attention to, and again, looking forward for your questions. And thank you, Raz and Nick, for the invitation to be part of this incredible conference. Have a great conference.
Well, thank you so much, Amanda, for your presentation. That was really great. And we got some questions during the session. And if you connect back in, there you are. Wonderful. Good to see you there. I'll jump right into the questions. So some of them you actually answered during the presentation. You were asked, are the immigrants vaccinated for COVID-19 when they arrive? I think you answered that, but I don't know if you want to mention anything else about that.
Sure, and thank you, Roz. Yes, we offer the Johnson & Johnson vaccine. We want to make sure that they get just one shot and not worry for the second dose when they get to the destination, whether it's Miami, New York, or Boston, wherever they go, whatever is their future home. So we offer them, and some of the folks already have been vaccinated with AstraZeneca in the Mexican side, but so there's not much we can do about that. But nonetheless, we do offer the Johnson & Johnson.
Okay, very good. Another questioner asks, Senator, clearly you and your teams are successfully engaging refugees. What might you suggest for large urban area borders? Please and thank you.
Well, there's a lot of challenges when you're dealing with this massive immigration, particularly probably everybody's been watching in the news what's happening in the border in Texas. So that is a big challenge. And so we have regular meetings with Homeland Security, the Office of the Commissioner, as I mentioned earlier, trying to bring the local nonprofits along the border to be ready for any search of any site along the U.S.-Mexico border, and that we're well prepared and coordinated, and most of all, that we have the resources to do that. What Texas border is experiencing is something that we have never seen, and of course, that's a very daunting situation that all the resources that being poured into that border to help the Haiti refugees and all the other Latin American countries refugees, that it's a challenge, and we're expecting another surge again. So we're preparing for with all the resources that we have to help our government and maintain our communities as safe as we can.
Thank you. So we have another question here. What inspired you to create your own clinics?
The gaps in care and the disparities in healthcare delivery in rural communities, and seeing the communities when I came to the Yuma area from Los Angeles, I just couldn't believe that we are in the border and we're looking at a third world kind of a conditions, living conditions, and no healthcare, very limited healthcare. This is back in 1987 when I moved from Los Angeles to the Yuma area. And then traveling to the western part of the state as we were delivering also the Western Arizona AHIP program, trying to recruit doctors and health professionals into the Parker area, Lake Havasu, Bullhead City, all the rural towns, and see the disparities of families and children not having access to quality care. And the lack of interest in some of the existing providers also not contracting with our Medicaid agency access.
Very good. And here's a question that sort of talks to the campaign that we're working on now. Jennifer from Banner Health asks, how do you communicate the clinic information to the communities you serve? What seems to work best for getting your message out?
Well, I think we tried all of the above, but one of the things that we did is to drive through stations and through the work that our community outreach workers are doing, either telephonically, telehealth, or person right now, sending the message of getting vaccinated. It's important to stop COVID-19 and its variants, which is one of the biggest concerns that I have is the source of additional variants that we're seeing and tracking in this area. But I think that we have to try everything. What works the best? I would say the one-to-one education. We have pamphlets that we created to make sure to understand the importance and eliminate all that miscommunication and social media, horrible, I guess, ideas or tales or why someone should not get vaccinated. So I think, Russ, you and I have been working on this in the last couple of weeks to intensify and eliminate all those wrong concepts about vaccines.
Yes, getting rid of the myths. I agree with you. Yep. Absolutely. Well, you have several questions about the promotoras, and I'll just give them to you in no special order. Matt asks, how many patient navigators do you have, and what sort of tools and resources do you think they need to optimize their engagement with patients? And I think you covered that a little bit in your prior answer, but he's asking how many patient navigators you have.
I think at this time we have about 35. We continue hiring more folks and be trained. We're going to be testing a new curriculum right now, including with the health literacy component that we've been working. But it's important to integrate it in the clinics with the whole team, and to not only the physical health, but behavioral health, to really understand the concept of what the role of the promotora is. Otherwise, there's this separation and isolation and working in silence that we have had in the past. But they understand, and once they understand the support and the importance of that cultural sensitivity and how they deliver their education to the patients, it's just priceless. It's just so important, and they can see the importance, and they can see the difference in patient compliance and understanding of the concepts that we're trying to get through the patient.
Yes, absolutely. Thank you. And CJ Pruitt asks a question along the same line. It says, Good Friday Eve, where does the behavioral health and the primary care for the patient intersect with common goals, as the diagram was too small to see?
Yes. When the patient comes in from either, they can have two entries. We get referrals directly to the behavioral health team by other agencies, but at the same time, we are requesting their physical health records if they have a primary medical home. If they don't, then we come into our clinics and they do the medical assessment to identify any chronic care issues or any other physical health issues. When it comes to the primary care, there is an assessment that is being done in the clinic to assess the depression and any other cognitive development milestones in children. So there's a really good coordination in identifying if there's any need for referrals on both sides, the physical and the behavioral health.
Thank you. And we get another question from an anonymous attendee. How to manage adolescent sexual and reproductive health in the era of COVID-19?
A big challenge because, when we went into this emergency state in Arizona, a lot of the folks stay home and the schools were not happening. And our clinics were also very vigilant about who was coming in, even though we did not stop having appointments in the clinic. But the teenagers was the most difficult group to reach. They were engaged in their own social media, and it was very hard to break through to get some of the messages through besides the parents, but we wanted it to get to the kids. We are escalating our outreach to teenagers right now as they're coming back to the schools through different ways, programs that we're working with counselors in the schools, and at the same time with our team of promotores promoting, vaccinations, promoting the wellness clinics for teens. In the past, we used to do even concerts in front of our clinics, and we raffle all kinds of things that those are the old days before the pandemic. So I can hardly wait for us to go back to do that.
Well, it looks like I've got the last question here. You mentioned that some of the white coat medical professionals did not initially accept community health workers in the clinics. How has that evolved, and is it working well now?
Well, initially, it was on both sides. The promotora, the community outreach worker, was very intimidated just by the presence of the doctor and the white coats and the medical team, and because they're so used to being in the community only. And so by integrating, for me, was more important because we're seeing the gaps in cares and also the education that the patients needed. We needed to engage the promotoras to follow up at the home. Those patients were hypertension, diabetes, and the group sessions, the educational sessions that we provided with them. But for the provider to understand and the medical team to understand that the importance of the intervention that the promotora bring and the culturally linguistic education that they can provide and the trust level. And so finally, after saying, we have to do this, and then finally they understood both roles and the importance of how Commons and the promotora benefits that medical team just by looking at the patient and seeing, okay, we're going to do a follow-up. And so immediately we saw the broken appointments going down in our clinic. We saw more compliance with the patient. And of course, our doctors and our quality assurance reports were showing that improvement in health overall in the patient. So I think they finally understand that they're part of our integrated team.
Well, thank you very, very much. I want you to know that this conference is reaching not only all of Arizona, but far beyond. We've got someone sending you regards from the Women's University in Mumbai, India. And it has really been a great presentation. Thank you so much. We've gotten several thanks that say thanks to the presenter for responding to my question. So once again, we greatly appreciate, Ms. Aguirre, your keynote speech. And we're going to close this session now. The next session begins at 9:30. And as Nick Colados said, please go into your agenda. Each session needs to be opened separately. It's not just one continuous Zoom. So a little before 9:30, we'll expect you on the next session. Amanda, thank you very, very much.
Thank you, Raj. It's been my honor. Thank you.